Okay. Good morning. Thank you all for joining us. My name is Andy Roberts, and I'm really proud to be serving as a project manager for a crisis response team from Northwell Health. I am here in Utah right now with 3 critical care nurses who served during the absolute worst of the COVID-19 response that New York had to offer. They have now volunteered to come out here to Utah to support our friends at Intermountain Medical Center to support them. During the worst of the pandemic, Intermountain Healthcare was one of the first health organizations in the country to volunteer to come out to New York to help us. They sent 100 caregivers, and they were out with us for a number of weeks. And we're really honored to have this opportunity to sort of return the favor to them. New York State and Governor Cuomo and Northwell Health have committed to sending 30 critical care nurses for a period of 6 weeks out here to Intermountain Healthcare. I'm really honored to now introduce you to one of our nurses, Madison Montague. Madison?
Hi, everyone. My name is Madison Montague, MADISONMONTAGUE. I am a critical care registered nurse at Lenox Hill Hospital. I work in the CT ICU and also COVID ICU as of a couple months ago, I guess. So like Andy said, Northwell and Governor Cuomo have committed to sending 3 separate deployments of 10 critical care nurses each. And myself, along with 9 other critical care nurses, were lucky enough to be part of the first group. So we got an email about 4 weeks ago now, and it was essentially explaining all the volunteers that Intermountain Health had sent when we were in, like Andy said, our absolute peak. We really needed help. And Intermountain was one of several facilities and travel places that sent us the relief that we really desperately needed. So when I saw an email asking for volunteers to help return the favor, I immediately felt like it was something that I wanted to do. I think you realize when you're in it how crucial an extra pair of critical care nursing hands are. And I just wanted to be able to provide that relief like it was provided for us. And I think that that's exactly what we've done so far. I'm happy to say that we got to integrate into several different ICUs in the Intermountain Health System. So we were primarily staffing the respiratory ICU, but we also sent nurses to the cardiac ICU as well as the shock trauma ICU for COVID and non-COVID patients to provide relief to their staff, free people up to get trained in some more technical skills like ECMO, and really just make sure that the staffing ratios stayed appropriate and that there were resources and charge nurses. And I'm really, really glad that we got to do that. This is actually my last shift today. And I never thought that I would say that I was sad to be walking out of a COVID ICU, but the kindness that Intermountain Health and everyone in Utah has shown us, it really was heartwarming. And I think that it provided even more sense of gratitude than I had before. I was endlessly grateful for all of the travel nurses that helped us during our peak. Really, it's hard to describe. But the fact that we showed up to a new place just wanting to help, and everyone was so excited to teach us and learn from us, and it was really just truly collaborative, and I think a good representation of what we can do as healthcare providers. And we'll just continue to lean on each other. And when things get hard, we reach out to each other, and that's how we get through it. So I feel really lucky to be part of this, and I'm excited for the next two groups that get to experience it as well. So I'm going to introduce you guys to our next nurse who's here, Jeffrey Rosa.
Hi, good morning. My name is Jeff Rosa, Jeffrey-Rosa, Jeffrey Rosa. I'm a critical care nurse at Long Island Jewish Medical Center. I primarily specialize in surgical intensive care, and I'm certified as a CCRN as well. So as Madison and Andy said, April were terrible months in the ICUs back home in New York. And when Mr. Dowling, our CEO, reached out to other healthcare systems looking for help, the first one to stand up and say, yeah, absolutely, we'll be standing right by your side, were the nurses from Intermountain and all the professionals from Intermountain. So when that email came out to us looking for critical care nurses to come here and volunteer to come here, there was no hesitation. It had to be done. They came to us when we were in need, and I felt compelled and driven to be here during their need. And then came that second email where it said, you've been selected to be part of the first wave. And I'll be honest with you, I had to do a gut check. Now it got real. And I said, am I ready to face the same situations that we faced in New York back in April? And when I came here, I had to do that gut check, and I was a little scared, to be honest. But fortunately, everyone here has been so incredibly welcoming, and everyone here has made it feel like a second home. And these patients, they're still sick. They're not in the same conditions as they were back in New York, and they're using some different treatment modalities, and they're using different options that we were probably afraid to use back in April as we were learning about this virus. And I think that because of that, we've been able to learn from each other and grow. And everyone here has been so overwhelmingly welcoming. I mean, from the housekeeping staff to the cafeteria staff to the collegial relationship we've developed with other nurses in the ICU. I've worked in the respiratory COVID ICU here, as well as the shock trauma ICU here. And I've noticed it's a seamless integration. Like, they really are genuinely appreciative of us being here and our time here. So I learned a lot about being here, about how to manage these patients. So if we ever do get a second wave in New York, we'll be a little bit more prepared, both mentally and with skills. I also want to introduce our next colleague, Sharia Barbera from Southside Hospital, also part of the Northwell Health system.
I think I'm on. Hi, my name is Sharia Barbera, Sheryah. Last name Barbera, B as in boy, Arbera. As Jeff said, I work at Southside Hospital in their medical ICU. And I've worked there for almost a year now, and I have 3 years experience as a critical care nurse. So I was fortunate enough to work with a lot of the Utah nurses, as well as one of the critical care doctors, Dr. Harris, who came to my Southside to be one of our attendings. And I think the general theme of why we wanted to come was, team nursing. It's a basic concept that you learn in nursing school, where multiple different nurses, registered nurses, your LPNs, your nursing assistants works together to deliver, patient care to each and every one of your patients. And that extends beyond your unit, that extends beyond your hospital, even your institution. And Intermountain, as well as Northwell, saw that. And that is like one of the main reasons why I wanted to come, is an obligation to always take care of the patient. The patients really needed us when we were in the high ratios, and Intermountain saw that. And thankfully, in the Utah hospitals, the ratios aren't the same as New York. They're still 1 to 2, but the threat is still out there. It's always important to maintain the social distance and wear the mask in public. Coming out here, it's nice to see the continuity of learning about this disease, because it's very humbling to work, take care of a disease where you don't have a standardized care plan yet. But as my mother always said, when you're green, you're growing. And when you're ripe, that's when you're rotten. So in the medical field, we're continually learning new things. And it's nice to see the partnership between Intermountain and Northwell, so we could continue to get better outcomes for these patients.
He doesn't know. I'm just going to ask a couple of questions. Oh God, I'm going to ask a couple of questions. You've been there now for 2 weeks, and in the 2 weeks that you've been there, have you seen any change in the numbers, up or down, because it's such a fluid situation?
I think the numbers have stayed pretty consistently. I mean, we don't have access necessarily to the their daily census and their daily logs of how many patients are moving in and out of critical care and in and out of the hospital in general. But just, tactile feel, the numbers seem to have stayed pretty stable. We have certainly not seen any major spikes in their numbers. Some patients come into the ICU, they get stabilized, and then they get sent back to the floor. And very similar to what we see at home, we don't always necessarily know what happens to the patients once they get to the floor. Sometimes they get discharged home, or sometimes they stay on the floor for much longer time as they become a chronic patient. So without knowing the actual census numbers here at Intermountain, it's hard to say definitively, but just based on what you feel and what you see, I think the numbers have stayed pretty stable in the ICU.
Okay, last question. Because of your perspective being clear across the country, what would you like to tell folks? You're coming back in a few days. What would you like to tell the folks here in New York? Sure, we sort of touched on it, but people in New York are tending to think that this is just sort of easing off because our numbers are doing well. So what would you like to tell the folks here, especially based on your experiences in Utah?
I'd like to speak on that. We definitely, it's good to see our numbers going down, but, a lot of these patients that I see are non-compliant with social distancing, and they realize it. And they, just because someone looks healthy doesn't mean that they're not a carrier. They don't have to sneeze, they don't have to cough, they just have to talk to you in order for you to, inhale COVID.
Yeah, I agree. And if I could piggyback off of that, I would say social distancing and masking is why our numbers back home in New York plummeted the way they did. Like, they were talking about flattening the curve. We literally bent the curve. And we bent the curve because we were compliant, because we stayed on with the masks, because we socially distanced, and we followed the rules. And I think the moment we start becoming complacent and not following the rules and not wearing the masks in public, and thinking that this virus has been beaten, that's when we're going to see a resurgence. That's when we're going to see the numbers spiking again, and that's where we're going to see the ICUs getting inundated once again. So I think if there's a message that can be conveyed, I certainly think that that message has to be continue to mask, continue to wear the mask and social distance. Our management of this disease has gotten better, and what we know about it has absolutely increased, but that doesn't mean that we're out of the woods. That doesn't mean that the virus is defeated and the pandemic is over. And people need to not get complacent with that.
I couldn't agree more with what Jeff and Ray both said. I think that exactly what Jeff said, we should not be getting complacent. And a lot of frustration here that I've heard from various people in the hospital is that people in the community are still thinking that this is a hoax. I think that any healthcare provider that has been even mildly associated with this can more than assure you this is not a joke. It's very serious, and just because it possibly hasn't affected you personally yet does not mean that you should not be compliant with wearing masks, washing hands, and social distancing.
Thank you. Very great advice. Now, Angie, before we close the program, what would you like to say to all the nurses who have been or concluding their tour and will be deploying out to Utah? What would you like to say to all of them?
I mean, I cannot say enough about how life-changing this has been for me. I am not a clinician. I am an Iraq War veteran, and almost instantly you start to hear the stories and the experiences that Sharia and Madison and Jeff and the 7 other nurses that are out here have been through. In minutes, you hear some of the most intense stories that you have ever heard. And I realize that, first off, they have experienced more than I experienced going to an actual war. And I'm so proud to know them, but it honestly has given me, it's helped me realize that they are representing thousands of other nurses that are doing the same thing across our country. And the fact that they went through what they went through and then still had the courage to come out here, not really knowing exactly what the situation was, it's been incredible. I'm so proud of them. I'm proud to have had an opportunity to get to know them. We all work for Northwell Health, but we all work in different parts. It's a big organization. So I'm just so proud of them. I'm so thankful for what they and so many others just like them are willing to do for each other. So there's this sense of them serving other nurses and other healthcare providers, but for what they are doing for our family and our friends and our communities. So it's just been amazing. I'm so thankful for what they do every single day. And, we all talked about we're already talking about having a reunion and getting together when this is all over. So thanks.
Well, this brings us to the end of this program. Everyone here wants to say thank you all so much for doing what you're doing in Utah and for speaking with us today. And we can't wait to see you when you get home. Thanks so much.
Thank you.
Thank you.